Years, and also have worked on statewide health workforce and diversity. So my dedication is all about you. It's helping you discover and achieve your authentic health career and have the life and impact that you want to have. I'm also, though, about helping health employers and our state and underserved communities get the health workforce they need. So the comments I'll be speaking to you about tonight come from both of those perspectives. So I will share my screen and look forward to engaging with you. I wish, so if you have questions along the way, just go ahead and raise your hand in the room, and I'm gonna count on Lena to help us manage the conversation. Can everybody see my screen okay?
Yes.
All right, let's see here. All right, so I'm going to start with these, showing you me with these amazing health professionals I'm showing them because they are living their authentic health career. These are alumni of the Health Career Connection summer internship program that I run. Health Career Connection has supported over 5,000 students of color to pursue health careers, and many of them are like the people in this picture. In that picture, the woman standing next to me is a physician who's an adolescent medicine specialist, also has her MPH. Next to her and next to me are other physicians, our public health people, our nurses, our researchers, people working in foundations. And so they're smiling because they are really living their authentic health career, and we're going to help you discover and achieve yours. So the way to do that is we're going to talk about, first of all, in order to know what your authentic health career is, you need to know what are the hot and emerging health careers that are out there. And Lena, as Lena mentioned, we all may come into this with some preconceived notions about which might be the career option that's best for us. We might really be really clear, or we may have no idea. So one of the keys is to get exposure to what's possible. If you can see it, then you can be it. So I'm going to share with you what are the hot and emerging careers so that you can make a well-informed choice about your path. Then we're going to help you to figure out how to choose. We're going to talk a little bit about public health, because as a public health person, I want to encourage you to consider public health as part of your journey, whether you're going to be a clinician or whether you want to focus on public health separately. Then we're going to have you do a little bit of work. This is going to be not just listening, but encouraging you to do a little bit of work on your authentic health career path by defining your values and what you're good at and enjoy doing, and refining your directions. And finally, we're going to end with some, what can you do now? There's internships, there's jobs, there's other opportunities I'm going to share with you. So that's what we're going to talk about tonight. So let's start out with, what are the hot and emerging clinical careers? And where I'm coming from on these is, I was the co-director of the California Future Health Workforce Commission. And that was a commission that worked for 3 years with the leading health executives, the leading deans of medical schools, people that worked for health advocacy organizations, foundations. And our question was, looking at how we're going to improve health and health equity in California in 2030, which was the time horizon. What are the health careers that are going to be in the highest demand and that are going to play the biggest role in improving population health and are going to have great jobs for people like you? We want to look at into the future. And so these were the career paths that were identified as those that are in shortage now, are going to be in high demand in the future, and are going to play an important role. And they range from primary care. Primary care, there were 3 overarching priority areas. One was primary care and prevention, which includes public health. One was behavioral health, and one was care for older adults. And within those 3 overarching areas, there was identified a need for more primary care physicians. And it was nice to see the word cloud of what you all are interested. But how many of you are interested in being a primary care doctor? I can see you a little bit, so raise your hands if that's possible. You don't have to be a doctor. You can be an advanced practice nurse or physician assistant, like a nurse practitioner, nurse midwife. How many people are interested in doing that? Raise your hand so I can get a view there. Okay. On your way to becoming a doctor or a nurse or nurse practitioner, you could be a medical assistant. Medical assistants are in high demand. and you can get good training, get your clinical hours covered for PA programs, and get great experience. And you can get paid $27, $30 an hour as a medical assistant. Some folks do that. One of my Health Career Connection alums was trying to decide between being a doctor, being a nurse midwife, or being a nurse practitioner working on women's health. So she worked for 2 years after her undergraduate degree in a clinic, being a medical assistant in a women's health clinic. And after that exposure and that experience and the mentorship she got, she chose to be a nurse practitioner and nurse midwife combination. That was the best way that she could have an impact. And she'd wanted to be a doctor her whole life. Her mother was actually a doctor, but she kind of chose a different path. There is no health without mental health. So behavioral health is a combination of mental health and dealing with people who have substance use issues. And I'm a Native American in my Indian tribe in rural North Carolina. Behavioral health issues are the most significant health issues that we have. We have prescription drug abuse, we have alcohol abuse, we also have depression, anxiety, other kinds of things that are very, very common. And so we're reducing the stigma. We're working on people getting care. We're working on building more behavioral health workforce. And in California, 2/3 of the people who have mental health, who need mental health care, are not accessing mental health care because there aren't enough providers, and particularly not enough providers who are culturally and linguistically competent and who are serving underserved communities. And so we need more people to go into behavioral health careers, and we'll talk a little bit more about that. Those of you that are good at microbiology, the hardest to fill position of any position in California is a clinical lab scientist. And that the average age of clinical lab scientists is 70 years old. Pretty scary, right? These are the people who run all the lab tests in hospitals and in public health labs and those kinds of things. So with 4 years of training and an internship, you can be a clinical lab scientist. Pharmacy is going to be continuing to play a bigger and bigger role, particularly very exciting as we're working towards more personalized medicine. And it'll be exciting to see the roles of pharmacists. Nursing, particularly with the pandemic. Prior to the pandemic, nursing was mainly specialty nurses, people who wanted to be in the ICU, the emergency room, the OR, those kinds of places, OBGYN. But now there's a high demand for nursing in all different capacities within hospitals and outside, and within public health. Nursing as another field as well. And then as people get older, there's a more need for care coordination, and people who are social workers, people who are nurses, people who have other clinical backgrounds can help coordinate care. There's a need for more of a home care workforce to take care of people at home. We have a silver tsunami where people in my generation, the baby boomers, are going to be continuing to get older over the next period of time, and are going to need more care, but are going to want to be at home and want to have healthier lifestyles. And so we need to be able to help people age in place. I saw some of you are interested in physical therapy, that PT is going to be increasing also with the aging of the population and how active people are. And can't forget about oral health. There's no health also without oral health. And finally, advanced illness care at the end of life, people, hospice and other, we're going to need people in all these areas. So there's a lot of opportunity. There's a lot of need for people to go into these clinical careers, but these are the ones of all the clinical careers that are in sort of the highest demand. So any question about these clinical career paths, any of what they are and what the demand is, any questions about them?
You have questions?
Yeah, can you hear me? Just speaking.
Yes, sir. Yeah.
Yeah, it wasn't listed, but what are your views on the clinical exercise physiologist position? I know UCI offers a job listing for that, but I haven't seen very many internship postings or ways to get involved in that kind of career.
That's a great question. It's not one that comes up as much in the work that I'm doing around what are the highest demand health career paths. I know it's an important career path. I would assume that it's growing, given the population and given the needs, but I don't know a lot about that, unfortunately. Is there a major there at your campus that someone could help you with understanding, where do graduates go, and maybe getting to network with some of those graduates and do informational interviews and other kinds of things. Is that something you might be able to do?
Yeah, I don't see like very many outlets for that. I know exercise science is probably a popular major for that kind of field,
Yeah.
but I see a lot of people going into that field from Cal State schools because they have that kind
Yes.
of um, like physical application versus research-based
Uh-huh.
application. Um, but yeah, beyond that, I thought UCI would maybe have like a volunteer internship position, given that they have a listing for a job of that title, or like some kind of
Yeah.
Yeah, so let me just, we can definitely connect you. I think we also have some other students that might connect you to areas that may be of interest. So let's talk about that after.
That's great. Okay. And then if I can be helpful, Lena, let me know. I can help take a look at that as well. All right,
Thank
so
you.
these are the emerging clinical careers that are sort of besides the behavioral health ones that we're going to talk about now. We talked about the importance of behavioral health, particularly with the pandemic and just acknowledging that now that and with other things going on in our world, social political issues and others, that there's a lot that we're going through and a lot that and finally I think people are feeling more comfortable to come out and talk about the needs that they have and get the support that they need. And so we need the workforce to support them. And so you can be in behavioral health as a doctor. You can be a psychiatrist that practices, that is a doctor that also is trained in psychiatry and prescribing drugs and treating people with mental health issues. But you don't have to be a doctor. You can be a psychologist, which is a PhD or a PsyD that helps provide therapy and other types of psych evaluations and things. There's mental health counselors and marriage and family therapists that are master's degree prepared people and licensed clinical professional counselors. There's social workers, which is a big demand for social work, and there's a lot of money going into people building pathways into social work graduate programs and from social work graduate programs into the field. So there may be some great educational opportunities and funding opportunities there. You could be a nurse practitioner who also gets trained in providing mental health services and is a prescriber. And then there are things you can do just being a peer, being somebody with lived experience, either yourself or someone in your family, like a peer support specialist. Or there are people who are substance use disorder counselors. And then the state is investing $400 million in being a new category of mental health, behavioral health and wellness coaches. And those are for people coming out of undergrad. And there are also mental health specialist roles. Or you can be like my daughter has an undergraduate degree in public health and psychology, clinical psychology. And she is a project manager on a statewide project in Massachusetts that is a research project that's looking at how to better roll out substance use disorder prevention curriculum to high school students and how to coach them and how to support them. So there's a lot you can do in behavioral health as well. Anyone interested in behavioral health as a career path or any questions that you have about that? Excellent. We really need you. And there's a lot of funding right now going into people looking into California and the state. There's a lot of funding and programs for people going into primary care, behavioral health care for older adults. And then you don't have to be a clinician to be in the health field. We certainly now have learned the value of public health, and it's important to everyone all the time. And within public health, we'll talk about the different paths that you can go. In health policy and management, which is my field, I focus on health management. Most of the people who are managing health organizations now are heading towards retirement age. So we need people not only who are clinicians, but the people who are managing organizations, the people who are setting policy, they have huge influence on who gets covered, what gets covered, who gets access, um, what's the quality of services, how are resources allocated, how much is our organization going to prioritize health equity and diversity, equity, inclusion, what services are we going to be providing to the community, at what level. There's a lot of things that people in health policy and management decide. And I was a management person first. Now I work on policy around health workforce and diversity, including actually working on the getting the budget and legislation passed that created the funding for the program that you are in through the Office of Healthcare Access and Information. So that was something that later in my life, I'm like, wow, through policy, we can affect thousands of people. As a practitioner, you can see people coming in during the day, and maybe you can see 20 or 30 patients a day, which is great. As a person in policy, you can affect thousands and millions of people, right? So thinking about those, and that you can combine those with clinical careers as well. Some of you might be a community health worker already or a health navigator, but there's a higher demand for those. These are people who are from the community, who are trusted, who know the community, who know how to empower people and help them get the services that they need. Social work, as I mentioned, is going to be really increasing, either in providing direct services or in coordinating care. Those of you who might be interested in being crunching numbers and big data and analytics, there's a huge demand for that. Think of all the electronic health records, all the wearables, all the things we purchase with our phone. It's all creating more data. We've got to turn that into actionable information to help prevent disease or help customize the treatments that will help people the most. Digital health is exploding. I'd encourage you to look into what is digital health. And basically, it's a digital way of providing services. One of my former Health Career Connection interns and a UC Berkeley alum that I worked with, she is the vice president of digital physical therapy and digital women's health for an organization called Hinge Health. And it's a startup company that's gotten lots of money, that's really growing. So encouraging you to think to the future, not just what you want to do now, but what's going to be popular 10, 15, 20, 30 years from now? What's going to be needed when you get your training and you're out there? Digital health information technology are going to be part of it. What's the role AI is going to play in all of this? And you got to think about the role that AI is going to play in all this, even in terms of what's it going to be like to be a doctor with AI, when you finish your training. It's going to be a lot different than it is now. So as you think about what you want to be, you got to think about what that profession is going to be like in the future. And is that something that you really want to do? Along the way, there's something called consulting. I didn't know what a consultant was when I was in your shoes, but consulting firms come to campuses and hire people, smart people like you, and have you work there for 2 or 3 years on your way to getting great training and getting great experience, and then looking great for your graduate school applications. And so consulting firms are a great way to go to consider jobs. And then entrepreneurs. Some of you, I grew up with parents from really low income backgrounds, and the mentality was like, okay, Jeff, just do something that's a secure job and don't screw up. And the world's kind of a scarce place. And then, a lot of my friends were entrepreneurs, and I'm like, oh, I could never do that. But now I've started and a nonprofit that's been around for 30 years. I've started consulting businesses, other kinds of things. And so I encourage some of you to be entrepreneurs. You've got a lot to offer, so you can disrupt what's happening and create things that are going to have impact. So this is the best time in my 30 plus years of being in the health field for you all to be coming into the field. There's so much opportunity. So the key is just choosing the path that's right for you, and then getting from where you are to where you want to be. I also value your program so much because it's working on increasing the diversity of people going into the health professions, which we know it results in better quality, better compliance, better communication, more trust, so many different kinds of things. And people who understand, have lived experience, who can really help meet the health needs of the population, design better programs. We're a long way to go from who the population is. You can see in this case, the Latino and African American population compared to the number of physicians that they are. And so there's a long way to go. So you all are really, really needed. And so why, of all the things you could do, why public health of all these different opportunities? And I'm a little bit biased because I took the public health path. For me, what drew me to public health was I wanted to work on improving access to care for underserved populations, and I wanted to address health inequities. And I wanted to do it in more of a prevention way. And public health is about going upstream before people are ill to create the conditions for people to be healthy, create the policies, the programs, the laws, all those things to help people be healthy. And then to address things like structural racism and sort of the persistent inequities that we have. It's about creating conditions for health, for people to be healthy, but then empowering people to be in charge of their health and to make change within their communities through policy advocacy, through other kinds of activism. It's about social justice ultimately, and racial justice is what public health is about. And you can do well by doing good in public health. Don't let anybody tell you that you can't. And even the more effective clinicians are going to be people who have public health backgrounds and degrees in addition to their medical degrees or nursing degrees or pharmacy degrees or others, because the way that we're going in the future is it's going to be about keeping the population healthy. And the way that the payment systems are going to work, there's something called value-based payment. It's about keeping people healthy and not having them come into the hospital and having them be healthy in their homes. And so public health is all about that, and it's crushing the things, the barriers that are creating these health inequities that we've so seen more strongly with the pandemic and some of the other things that are going on. So encouraging you to think about public health. How many of you are interested in public health in some way? Raise your hand. Excellent, excellent. We definitely need you, and it's a really important time. They just invested $7.4 billion in the public health, growing the public health workforce. So stay tuned. There's great job opportunities and other funding opportunities that are out there. So within public health, I'm going to just share a little bit more and see if you have any questions about, so what do you do with a public health degree? And in public health, you can either be like me, be in health administration and manage different types of health organizations. You can do that as a clinician too. A lot of times people who are clinicians, who are doctors, who are nurses, PAs, they end up, I've got a friend who's a PT, he has to run his own PT business in addition to being a PT, right? So everything requires management. So it's a really important area to learn, either as a direction or in a complement to what you're doing. We already talked about the importance of health policy. You could work in community health, which is kind of working at the community level on behavior change, on creating those community conditions, on advocacy. You could track the disease population, the distribution of disease across populations through epidemiology and biostatistics. You could work on infectious diseases like COVID, and there were many other emerging infections too. Maternal child health is a huge important area within the public health area. And then we've got to do a better job of helping people get access to healthy, affordable, nutritious foods and knowing how to bring them into their diet and how to make them available in schools and in all kinds of different settings. And then we've got to deal with climate change and environmental exposure and water quality and air quality and wildfires and all these other things that are really environmental health. And so if there's something in public health for everyone, the question is which is the right area for you. And I would encourage you to find out, if you're at all interested, to get some exposure and experience, to network, to do some internships, to volunteer, to do class projects, other things to really learn about these areas of public health and see if they're interesting to you. Even if you don't decide to do public health, you'll be a better practitioner if you understand these areas and you have some experience. So any questions about public health career paths, what any of these means? By the way, graduate programs in public health correspond to these different areas. And so you have to, when you apply to graduate school in public health, you've got to apply to a program in health management, health administration, or health policy, or public health nutrition. So before you go to graduate school, you want to get some experience and exposure. You want to figure out if you're interested in these areas, and then you can make the case in your statement of purpose, on your resume, in other ways that these are the right paths for you. So any questions about any of these public health career paths or public health in general?
Nope, I don't see any questions.
Okay, thank you. So people in public health, just the last thing about public health, a couple things, is that you can work in a public health department like the Long Beach City Health Department in your area, or the Orange County or LA County Health departments. You could work in a big hospital health system like Kaiser, like Cedars-Sinai, like Hoag Hospital. You could work in community-based organizations and community health centers. You could work in a physician group a foundation. You could do research. I saw some of you were interested in research as a path. You can be in global health. There's a lot of different things that you can do. So um, become narrow, I guess, in your focus, like which area of public health you're interested in most, but broaden your focus on where you might work. People also are working now at Google and Apple and CVS, and all these places are hiring people that have public health backgrounds as well. So there's a lot of opportunity there. So please check it out. We need you. You can also be a clinician and a public health professional. So this is Dr. Muntu Davis, my friend, who's the chief public health officer for LA County. He's responsible for the health of 12 million people in Los Angeles. And he was a primary care doctor who also got a master of public health degree, who chose to go into governmental public health. You can see that he is, you can do that kind of work, or you could just be a medical director. You could be a preventative medicine specialist. A lot of the foundation leaders in California are MPHs. You can be a researcher, a professor. There's just a lot that you can do. You can be like Dr. Joaquin Arambula, who's he's an emergency room doctor from the Central Valley, who got tired of seeing all these people come into his emergency room with things that were preventable and not getting access to the care that they need. So he became a legislator, and now he's utilizing the fact that he's a physician and that knowledge and credential and expertise to make policy change. And he's passing legislation on health for all in California. And he's the one who got the bill that funded your program done. So you can do these kinds of things as a physician and somebody who's in public health. And finally, you can also be in housing. Public health, there's a saying that healthcare access is only about 15% of what keeps people healthy. And when you need it, you really need it. But the rest of the time, the things that really influence health are the social determinants of health, which include food and housing and where your zip code is and all these other kinds of things, getting jobs. The things that relate to people improving health are jobs and economic development and education. So you can work in public health in these areas as well. And there's a lot of money going into affordable housing and job creation and all these things. So those might be good places to work now on your way to being in the health field. So of all these things, my goal is, and I wrote a book about it, is to help you figure out what's best for you. I've worked with over 10,000 students now through UC Berkeley and Harvard and Health Career Connection and many other campuses to figure out which among all these paths is the best one for them. It's called You Don't Have to Be a Doctor on purpose, because we've just shown that you don't. However, it doesn't discourage you from being a doctor. It actually just helps you think critically about whether it's the best path for you or not, and helps you, if it is, to figure out how to best present yourself to get into medical school, to be able to get jobs, to have the life and the career that you want. And so for the less than the cost of a movie and a couple of slices of pizza, you can have some good career guidance in either a paperback, or you can buy it for $9.99, an electronic version. But anyway, it's on Amazon. I can send the information to Lena, and I encourage you to purchase it. I know that it will be helpful. It's not an academic book. It's a very practical book with stories, with exercises, things to support you. Because I'm all about you the first time around deciding what you're doing. That's my public health prevention now, is to have you make a well-informed choice about who you are and what you really want to do the first time around. You don't want to be like a friend of mine whose brother went through medical school at the University of Chicago and came out with $250,000 debt, decided he wanted to be a brewmaster instead. So not that you would do that, but I just want you to really think carefully and make a well-informed choice. So how do you do that? So I'm all about you. You've heard me use the term. I'm going to define it finally. Like, what is your authentic health career? And your authentic health career, and notice it's a path, it's not set in stone, but it's there's only one of you in the whole universe. You're here for a reason. You have great talents. You wouldn't be where you are without great talents, passions, goals, and your lived experience is invaluable, right? You're having it for a reason. So why not choose a health career path that really suits you, where you're going to really get to put who you are authentically into play, and where you're going to be happy, you're going to be healthy, you're going to have the impact that you want to have, and you're going to do well by doing good. This is from Steve Jobs, who changed the world, right? All of us have probably something on our desk or in our pockets from Apple. He's one of the founders and CEOs of Apple. His Stanford commencement speech is like, your time is limited. He only lived to be 57 years old. Don't waste it living someone else's life. A lot of people are going to tell you what you should be. And I have people whose extended family are calling them doctors when they're in undergrad and they're not doctors yet, but they know they're going to be a doctor. And some cultures really value only doctors and lawyers and businessmen or nurses or engineers or whatever it is. There's a lot of other people who are going to say what you should do. Your friends are going to go to graduate school. They're going to do all kinds of things, but have the courage to listen to your own heart and your own intuition. They know what you really want to do. So I'm encouraging you to really think about that. I know that sounds, touchy feely or woo woo or something, but it's really not. And it's really not also because in the end, it's really, there's some hard reasons to listen to that too, because you going to medical school, those of you who want to go to medical school, it's going to cost you your 20s, because by the time you finish your undergrad, some of you may have to go to a post-bac program, or you may want to work for a couple years first. And then you go through medical school for 4 years, you have residency, you have fellowship, and pretty soon you've worked really hard. You become a doctor, which is fantastic. If it's what you're supposed to do, please do it. It's what we really need you to do, and you're going to be happy. But you're going to be giving up a lot of your 20s to do that. And so really, you just got to think about, is that what I really want? One of my former students from Health Career Connection, who is now living her authentic health career as a family medicine doctor who serves low-income women and as a policy advocate around reproductive health rights. She said, Jeff, that thing you share with the students about you're giving up your 20s to be a doctor? I said, yeah. She goes, you're wrong. She said, it's your 20s and your early 30s, both. Because she got her first job out of training at 33 years old. And so she said, you know what, just tell them, just be sure it's what you really want to do. The 20s are your defining decade. The choices you make in your 20s set up the rest of your life. There's a book called that. And graduate schools are looking for fit. You have to make the case in your statements of purpose, in your interviews, that you're a good fit. And my friends who are the admissions directors for medical schools, they say, Jeff, we can tell who the box checkers are a mile away. I said, who are the box checkers? And they said, well, those are people who they went to school like UC Irvine. They did well. They got a good MCAT score. They got it on a publication. They went on a medical mission trip. They were in these leadership positions. They did all the right things. But when it comes down to it, and we asked them in the interviews, why do you want to be a doctor? What are you going to do as a doctor? And what's your passion? That they can't, and listen to these words, authentically convince the admissions committee that they are really want to be a doctor and they're a good fit. So you want, in your authentic voice, whether it's in an interview for medical school or a statement of purpose for public health or interview for your PhD program in psychology or your research program, you're going to have to convince folks that it is what you're all about. And it also will affect your health. In my situation, I was working in Boston. I was at Harvard teaching. I was at Harvard Teaching Hospital. I had a big executive job. I had making a lot of money, 2 wonderful kids at home, wonderful wife at home. I was miserable because at this point, after 20 some years of being a health executive, it was no longer my authentic health career path. And so while I was good at it, and it was prestigious, it was secure, it was eating me up inside that this wasn't really my authentic health career. And I went to the doctor with a sore throat, and the doctor looked at me and he said, wow, he goes, you look really depressed. And are you okay? I'm like, hey, I'm here for a sore throat. And he's like, no, we need to talk. Your body is not in good condition. Your mind is not in good condition. And so even though on paper, I should have been the happiest and most successful I was not living my authentic health career anymore. And it was eating at my health and my happiness. And so it's not a concept here. There's a lot of real, and we'll talk about that in a minute. I'll show you more about my story in a minute. So how do you pull this all together, right? And again, if you want to be a doctor, if you want to be any of those things, just make sure it's the right thing, right? So how do you know? So how you know is you find the alignment. This is the life career alignment triangle. The alignment between that's what do employers need? That's why we spent that time on the front end. Like, what are the hot and emerging health careers? That's what employers need. So you want to know that. Okay, now these are the hot and emerging health careers. And then the bottom is, well, what are your passions? What are your values? What are your goals? You personally, your unique ones, yours, not your family's for you, not other people's, yours. And then what are you good at? Not only what are you good at, because you all are good at lots of things, but what do you enjoy doing? What are you going to enjoy doing all day long? There's a lot of things I can do that I can do, but they're not necessarily what I want to do. And they're not the best use of the highest and best use of my time and talents and passion and all those kind of things. So what you want to do, your job is to figure out, okay, what are the needs? Who am I? What's my why? What's the bottom of the triangle? And then how can I align? That's why it's called alignment. How can I align my authentic path with what the needs are out there, or disrupt things so that you can create the path that works for you? Because if you can find the alignment between those things, you're going to have that fulfilling work. You're going to be living your purpose. You're going to be able to have financial rewards, even if it's something that doesn't seem like it might be financially lucrative. It may be if it's what you're supposed to do and you work hard, and your health and wellness are part of it. So back to my story, right? So here I was kind of going, wow, all right, my body is telling me, my mind is telling me it's time to change. And if you're not going to change, Jeff, it's just going to get worse. So in my heart and intuition, I knew that my calling and my authentic health career was to work with students like you, and others to discover and achieve their authentic health career. And I do that by teaching, by running Health Career Connection, by developing pathway programs. It also was about improving health equity and racial justice. And I went from being a hospital administrator. I was like, okay, I'm not doing those things as a hospital administrator. I'm good at it, but that's not what I'm here to do. So I took a 65% salary cut. At the time, my third child was on the way. My wife was working hard at home, but not in the industry, and moved my family back across from Boston to Berkeley, to take a job at UC Berkeley, putting in the center of what I do my authentic health career, working with students, working on health equity in the community, working on diversity and health workforce. And it was really hard for a long time financially. A lot of my friends reminded me how much money I gave up by being a health executive, how much I left on the table. It was, besides marrying my wife, was the best decision I ever made, and it was priceless. And the money will come if you do what you're really supposed to do. It's taken me many years, but now I have a good living, and I would do what I do for free. And there's nothing more freeing than feeling like that every day. It's like I'm doing what I'm supposed to do, so I would do this for free. And oh my gosh, I'm getting paid. I get to work with people that I love to work with. I get to feel like I'm making a difference. That's worth everything, right? So it is possible. If I could do it, you could do it. And sometimes we're just surviving, right? So you're just trying to get through organic chemistry. You're just trying to get through this talk today. You're dealing with COVID. You're dealing with family issues, food insecurity. Sometimes we're just surviving, right? Sometimes we're searching, right? I took me 3 to 5 years to make that decision. I made it after a long search. And then finally it was in the being stage. And so it can all come together. But it's a process. And so, wherever you are, be bold and mighty forces will come to your aid. A friend of mine who started and sold 3 companies and survived 2 very nasty cancers is the one who gave me this quote from Goethe. And it's true. If you really go for it, it's going to work out. That I took a big leap of faith, right? And it could not have worked out it's better than I even imagined, that it could be. And you're exactly where you're supposed to be now. You have options. Some of you know exactly what you want to do. You're going to keep going forward. It's all going to come together. Yes. Some of you are like, oh, now I know what I want to do. There's so many different options that are out there, or I'm trying to decide between these different things. Wherever you are, it's okay. Just keep going, right? And have the intention that you can have your authentic health career. So this is the pathway to your authentic health career. And these are the steps in my book that are part of the 9-part framework that if you can do these things, you're going to figure it out and you're going to get there. So the first thing is exposure to what's possible. That's what we did. The top of the triangle. What are the hot and emerging health careers? What are employers looking for? Where can you work with a public health degree? There may be other things that you want to explore. Where can I work as a PT in the future? What are PAs doing? What's it like to be a doctor? What's it asking doctors? What's it going to be like? What do you think, Dr. X, who's doing the job I want to do? What's it going to be like 10 or 15 years from now? So you want to get as much exposure as possible to what is possible. Because again, if you can see it, you can be it. It's also good to find out what you don't want to do, right? The second thing is the bottom of the triangle. What are you good at and enjoy doing? What are your values? What are your passions? What are your goals? What's your lived experience? And then being able to say, great, now let me get some practical real world experience. Let me do an internship. Let me do a research program like this cohort program that you're going to be part of, hopefully be part of. A job post undergraduate. It's good to work post undergraduate if you're not sure what you want to do. And even if you are, to get some more experience to help take you where you want to go. There's nothing like getting experience to really help solidify what you want to do and make the case for you. It looks really good on the more hours, clinical hours you have, the more things that you have in your background, you're going to get into the graduate program that you want and be more and know what you're going to get more out of it, right? So then after you've done your homework, do you choose and actively pursue one of these directions? And you can see these words are intentional. I want you to choose and actively pursue, not just choose, but actively pursue. All right, do I want to be a PA, a doctor, or a nurse practitioner? Well, all right, those are my three directions. What steps am I going to take to figure it out? Like the student I said who worked as a medical assistant. And then your educational preparation comes in. Notice your education isn't the first thing. I often talk to students, I'll say, hey, so what's your health career direction? They'll say, I'm going to get an MPH. And I said, well, I want you to go into public health. We love that. But that's not a career direction. That's a degree to get you in a direction. So you want to think about what is your career direction first, and then what kind of education do you need in order to be able to get there? You get knowledge, skills, credentials, and connections from your education. It's not good enough to have a great UC Irvine undergraduate degree and then go on to a graduate school and do really well. There's a lot of good people out there. So you got to package yourself. You've got to have a good LinkedIn profile and a good resume and a good cover letter and good good elevator speech, those kinds of things. So you got to package yourself. And then it's either network or not work. And some of you, when I came in, Lena was having you all get to meet each other and build those relationships. The health world is a small world, and networking is what makes the world go round. And the more people that you know, and the more people who know what you want to do and what you're good at, and all those things, the more job opportunities you're going to have, the more opportunities to get into health professions school, the more funding from health professions school to pay for it, which many of you are going to get. So it's either network or not work. That's one of the chapters in my book. And I know networking may be uncomfortable for many folks. You just need more practice, and you may never become comfortable, but you can become good at it. I was the world's worst networker when I was in your shoes, and now that's what I'm probably most known for. So it is all possible. And then finally, there's two other aspects here. You have to have belief and courage. That taking that 70%, 65, 70% salary cut that I took is really a big deal. And then having ongoing learning and adjustment. You have to be able to know that things can change, and the world's going to change. What you want to do, what I wanted to do when I was single with no children, is a lot different than what I need now with towards the end of my career and with 3 adult children. And so you will be able to adjust as needed. So the reason I share this with you is because I found with thousands of students and myself that if you can follow these steps, you can get to discover and achieve your authentic health career. And you can really get, you can use this to diagnose, well, what do I need more of? So let's go through. How many of you need more exposure in order to discover and achieve your authentic health career path? Raise your hands if you need more exposure. Probably everybody should need more exposure, right? How about more practical experience? Who needs more practical experience? All of you, yes. How many of you need to have better packaging, better LinkedIn profile, resume, those things? And how many of you need to strengthen your support network? Everybody needs a stronger network. And how about strengthen your belief and courage? It takes a lot of belief and courage to, as one of my friends did, to tell his immigrant parents that he had gotten into medical school, but he was going to public health school instead. when his parents their whole life had dreamed of him going to medical school. And here he was, and he got into a really good medical school, but he went to public health instead. And now he's a professor of public health and a chairman of his department doing home research on health inequities in his community. His parents couldn't be prouder. But it was tough, a lot of belief and courage in the short term. So I encourage you to identify, well, which of these things am I already good at? Which of these things do I need to strengthen? And to turn this into action. Like, okay, in the next 6 months, I'd pick like 3 areas and say, which 3 areas am I going to strengthen in the next 6 months? I'm going to work on my packaging, I'm going to work on my network, and I'm going to get some more exposure. And then give yourself a plan to make it happen. Some people feel like this is too structured. Oh, well, I just go with the flow. I'll figure things out. But there's a saying that opportunity is where luck and preparation meet. This is where the preparation part comes in, and you create your own luck, going forward. So any questions about the framework or the alignment triangle before we have you do a little bit of work on it? Any questions or comments? Make sense? Okay. Well, now what we want to do is just talk a little bit about getting exposure and then put you to work. So getting exposure is really important. I'm a big fan of informational interviews, which is you asking people that are doing what you want to do or that are just out there in the field or alumni of UC Irvine, medical students in the prime program at UC Irvine. Can I have an informational interview? Use those words. Not can I meet with you, but can I have an informational interview? Because it means you're meeting with them to get information. So it's a twofer. You get to meet somebody to get information about your career direction, and you make a good relationship, and the person becomes part of your network, going forward. I encourage you also to do as much as possible to do internships, to be in research related programs like the Prime Pre-Health, to go to conferences. I'm running a conference in Sacramento the next 2 days that has the who's who of health leaders in California. And if I had known you, I would invite you to come. In the future, I will. But coming to conferences, you get to hear what the future is, and you get to meet the people doing the work. I encourage you to do projects with organizations in the real world rather than just make them up or do online research or literature reviews. I encourage you to do job shadowing, particularly those of you interested in clinical work, which has been a little bit harder with the pandemic, but I think it's still possible. And as Lena said earlier, you might volunteer, you might do your research, and definitely join some professional associations. So these are things to build into your schedule on top of your academic work. Discovering and achieving your authentic health career is like a 1-unit seminar that I would add to your schedule that you're in charge of, because it takes time in addition to academics, but it's helpful to graduate kind of knowing what you want to do and where you want to go and getting a job and all those things. And if you make the time now on top of your academic work, which I know is hard, it's a very demanding school that you're going to, it will definitely pay off. I'm going to skip this one and I'm going to just have you do some work here. So I mentioned doing a little bit of work. I would believe that if you build the life that you want, to build the life you want to create the work you love. So there's a few ways to do that. So I want you to really write these things down or type them into your computer or your phone or something. We're first going to say, what is one thing that you're good at and you enjoy in your personal life? And then one thing that you're good at and enjoy that you'd like to incorporate into your career. There are things that people are good at that could be, and that you really enjoy doing, that you can make it part of your career. How fun would that be if what you're good at and enjoy doing it could be part of what you do for your job, every day? And so take a moment, and I'm just encouraging you to write that down. It's going to be a little bit harder for people to share here. There's no chat and there's no, it'd be hard for us to have the dialogue, but write that down, because I think it'll be something that's helpful to you. And it could be something like, hey, I'm a really good listener, of people. And guess what? Listening is a really important skill in being in health administration, health policy, being a clinician, really listening to people. Or, hey, I'm a great connector. Or, hey, I like dance and music, and I can turn that into music therapy. Or I'm really good with my hands, and so I could really I just think I'm so good. I want to heal people through my hands. But whatever, think about what are you good at and enjoy doing? Maybe it's nature, and there's people that are incorporating nature into health. So just kind of tap into your passion and say, what's things that I'm good at and enjoy doing in my personal life that I'd like to incorporate into my career? Or it could be just for your career. Like, what are you good at health wise that maybe you're really good at data analysis. My son is in quantitative biology, and he's developing personalized medicine drugs, and he's just like geeks out on biology and on using data sets to do data analysis. He didn't get that from me, but that's his thing, and he's pursuing that path, right? All right, so that's one thing. The next thing is to really think about your values, right? The bottom of the triangle is thinking about your values, and so think about what values are most important to you. What I found is the people who are who are happiest and who are most effective in the health field are people who are doing work with organizations and with other people who share their values. And so, what are your values? What are the values that you are most important? There's intrinsic values like service and healing and creativity and fulfillment, diversity, or there might be things that are extrinsic like pay and job security and status. Or then there's like, okay, family. How important is family? And not only obligating, but enjoying your family. And how about flexibility or freedom or travel or or just having time for you? What are the things that are most important to you? And maybe writing down like 3 to 5 of your values that are your top ones. Oops, let's go to the last one. Oops, sorry. Got a little bit ahead. So maybe can folks share some of their values? And Lena, you can help hear from people. What are some people's values?
What's your name?
Caesar?
Yeah.
Caesar. Okay, Caesar.
I think flexibility is a big value for me personally, especially when deciding your career, because I understand that mental health is a big issue with physicians' careers. So possibly choosing a specialty if I do decide that route that has some form of flexibility at some point is really important.
Thank you, Caesar. Thank you for sharing. How about a couple others? Yeah.
Shada.
Yeah, sorry. Hi, my name is Shada.
Shada?
A value that I think matters most to me is probably like being caring, I guess. I don't know like the specific phrase for it, but I think going into the healthcare field, you're expected to have a sense of empathy and understanding for your patients and or just people that you work with. And I think that's something that I value and I would bring into the healthcare field because I mean, if you're in the healthcare field, you don't have care, then you're in the wrong field.
Absolutely. Absolutely. So well said. Thank you for sharing. Who else?
State your name.
Oh. Hi, my name is Nasa. A service that, a value of mine, a top value of mine is service to others and
Yeah.
the want to help people. Because as
Yep.
a person who's been a patient, I know just how the experience is going into a hospital, thinking that your life is never going to be the same and that you're screwed. And so I want to use that experience of mine to help others feel safe. Coming into a hospital and learning that this is a way to improve your life and that it is not over yet.
Thank you so much. That's so beautiful and so really needed. Let's have one more share.
Hi, my name is Rakik, and
Hi.
a top value of mine would probably be reform. So whether that is within being like a healthcare provider, within being like a physician in my personal interest, or outside of that as an advocate for the community, reform in healthcare is a big value of mine.
That's fantastic. That's so needed and I'm confident you'll do it. So I think I would encourage you to list out your top values and then there's a saying, okay, well, if these are my values, then what am I going to prioritize to make them happen? And how am I going to live according to them? And how am I going to prioritize these relative to my health career choices? Like and that could be choices of profession, could be choices of which school that you go to based on the values of those schools. The school, like UC Berkeley, the business school there, they actually have 4 or 5 core values, and they actually ask you write about it in your statement of purpose, like how do you align with these core values and how have you operationalized them, and what do you want to do when you come to our business school. And then there's organizations that have core values too, and so values are important, and you're going to have to make some lifestyle trade-offs about family versus work and other kinds of income versus time and all these things. So being clear about your values and your why are really important. Then you can build those into your statement of purpose and your interview conversations, with people. So then it helps to know what your direction is. And I'm going to ask you all to answer these 7 questions, because I found if you can answer these 7 questions, you can begin to have a clearer direction. And so the first thing is, and I want you to think about, you're living your authentic health career. You're doing exactly what you right now you dream of doing, and you're bringing your full authentic self and your lived experience to it. So if you're doing that, well, what population are you serving, or what population? So write these down, type them into your phone, whatever it is. But I found it's not just good by something about writing and typing or something actually forces your mind to think this through and be creative a little bit. Also, external processing about it is helpful. So what population is it that you want to serve? Maybe it's the Latino community, or it's your hometown, or low income populations. Maybe it's people in developing countries. Maybe it's teenagers or pregnant mothers, or maybe it's older people. But so what population or populations, you don't have to limit yourself, are you most interested if you're living your authentic health career? And then, so write those down, take a moment, take that in, right? That, okay, who am I serving? Could just be people in general, whatever will be authentic to you. The second question is, which health issue or determinant of health are you most passionate about doing if you're living your authentic health career? Maybe you're working, for me, it was access to care for underserved populations. And that was really what drew me in. And I followed that passion. Now it's empowering you to live your authentic health career, or addressing health inequities, doing a more diverse health, getting a more diverse health workforce. So maybe for you, it's violence reduction, or it's healing, it's diabetes or cardiovascular disease, reform that we just heard about. What type of organization do you want to work in? You want to work in a hospital, community health center, public health department, a drug company, have your own physician practice, research entity? What kind of organization do you want to work in if you're living your authentic health career? So you can begin to see, okay, I want to work with this population. I want to work on these issues. I want to work in this kind of organization. Like for me, it was a hospital that I wanted to work in. And then what kind of role or function do you want to play? You want to be a doctor. You want to be a nurse practitioner, a PA, an NP. You want to be a behavioral health, like a psychologist, or a hospital administrator, or a combination. You could be like, hey, I want to be a doctor who's also a policy advocate. So you're living your authentic health career. What role or function do you want to play? And it's okay to have multiple answers if you don't know, if you're still exploring. It's okay to say, I don't know. And then how close to the patient or the community do you need to be? An example of this is one of my students from UC Berkeley Public Health. She worked with patients and low-income patients and families before she went into school. And she said, I want to get some exposure to policy. And she did that for a summer. And she said, you know what I learned? I learned that policy, I'm too removed from the people that I want to serve, and I don't see the impact. Whereas her boss at the time said, that's interesting. I don't need to see the people I serve. I don't need to be in the community. I can have a huge impact. Her boss created a 54,000 person health access program with people who never had access to care. She gave 54,000 people access to care. She said, I don't need to see them. I know that they're getting access to care. I get letters from them. I see their improvement in their health status. I know I'm making a difference, and I can make a bigger difference. So there's no right or wrong answer. How about for you? How close to the patient or the community do you need to be? Do you want to be seeing patients one-on-one, or do you want to be in a research lab someplace creating drug discoveries or policy? And then finally, working backwards from the end, what's your definition of success? And this is sometimes hard in your early 20s, late teens, early 20s to know this, but why not think about, hey, when I'm older and I've worked hard, I've got my education, I've invested a lot in myself and in my career. What's success going to look like? And what impact do I want to have? Because you're going to spend a lot of time working. And so why not be clear? Success might be that, well, it's about being able to live my passion and impact communities and heal people, like some of you were just saying, bring my kindness and compassion to doing it. And I also want to have time for my family, and I want to have time to travel. I want to fulfill my spiritual commitments. I want to be happy and healthy. I mean, you can, be as specific as you can. And what impact do you want to have? Are you going to spend a lot of time? Do you want to, and I'll give you an example of all these answer these questions. And, you could say, oh, I want to work with the Native American tribe, Lumbee Indian tribe in rural North Carolina. That's my tribe. I want to work on 2 issues. I want to empower Lumbee students to become in health careers, health executives. Be in health careers, and I want to reduce the rate of, improve the rate of mental health access. I want to work in a community health center because I do want to be grounded in the community, but I also want to be a policy advocate. I want to be both an administrator as well as a policy advocate and a pipeline program leader. I want to be close to the patient, but I also want to work at the level of making policy change. And the impact I want to have, I want to see more Lumbee physicians. I want to see the people get mental health access and get better care, reduce the rate of depression, anxiety, prescription drug use. And my definition of success is that I'm able to do those things, plus, have the life, a good life with my family, have my children be able to afford to do great things and get an education and have opportunity. And I want to, be healthy enough to enjoy my life going forward. So hopefully you can see that if you can answer these questions, you can get a pretty good definition of what you might want to be or what you want to explore doing. So how many of you can answer one of these questions? Raise your hand if you can answer one of these questions. Okay, how about 3? How about 5? How about all of them? Okay, well, remember, you're exactly where you're supposed to be. You have some answers. So then you can use this as a way to say, okay, how do I find out the answers to these ones that I don't know the answer of, or how to be sure of the ones that I do. And then when you write your statement of purpose for graduate school, when you are in your interviews with people for jobs or for graduate school, when you're talking to your parents about what you want to do and don't want to do, these are great ways that you can actually, it's a nice thing that you can use to articulate who you are and what you want to do. So there's more exercises about this in the book along with the other ones. So hopefully this is helpful to you. Just have a couple more minutes. I'm going to tell you about now some opportunities that you can pursue now. If you don't know yet, it's okay. Just get through school, pay the bills, deal with COVID, deal with organic chemistry. It only takes one direction and some opportunities. Have the faith and trust in yourself and the universe that it's going to be helpful to you. So what you can do now, I'm going to skip this. Put yourself in the flow of people and opportunities, as I mentioned. Be able to do those informational interviews, develop your networking, find mentors, have a web-based strategy with LinkedIn and those kinds of things. Join a professional association of some kind. There's tons of them out there. And then there's some great internships. So there's paid internships. It sounds like the program that you're all in has paid research opportunities. That's fantastic. These are some other ones that are for undergraduate students specifically that you could take a look at. I'm going to talk about Health Career Connection in just a second. But the Lewis Ferguson internship programs are really good. Health Career Connection is the nonprofit that I've started and run for 33 years. It's all about inspiring and empowering you to be the next generation of diverse health leaders and professionals and live your authentic health career. We want the health workforce to look like this. This is a group of our interns a few years back. We provide paid summer internships and professional development workshops, mentorship, networking, connections to grad school. 71% of our students get jobs through HCC. 82% go on to graduate school in the health field. 88% build professional skills, and 87% improve their mentorship. It's 10 weeks. It's in the summer. Starts after you get out of school, and goes until you have to go back to school. It is 10 consecutive weeks. We have internships in public health and health management, behavioral health, community health, pre-med, not so much research. We have a part-time health equity scholars program, which is a virtual 8-week program. We do internships in Southern California, the Coachella Valley, Northern California, the Central Valley, New England, New York, DC, Baltimore, North Carolina, Chicago. So we have internships all over the country, but the most are in California. We would love to have you apply. This is for undergraduates, juniors, seniors, and sophomores who are motivated as well. I know that the application is available. It was opened yesterday, so it's due on December the 11th, and we really would look forward to your application. If you apply, say that you're part of this program, and we will take a look at your application. I'd be happy to talk with some of you about applying to the program if you're interested. But I highly encourage it. 5,000 people. They're doctors, public health leaders, behavioral health professionals. You name it, health administrators. And then I know that if you advance confidently in the direction of your dreams, your authentic health career direction, you're going to be really successful. And I'm going to just leave you with a couple of examples. Dr. Evita Limon Rocha from the Inland Empire. She went to UC Riverside undergraduate. She went to UCLA for medical school and got her MD and MPH. She's a child and adolescent psychiatrist, adult psychiatrist, bilingual, bicultural, also prioritizes her family. She recently has become the chair of the admissions committee at UC Riverside Medical School. And she's also on the board of an advocacy organization where she did her HCC internship. And then these are some of my colleagues getting their their MPH and Master's in Public Policy at UC Berkeley. Brittany Giles Cantrell, the woman furthest away from me, is now the director of health equity and health workforce for a large national public health foundation. And she just had her first baby. And so, we really want you to have the life and the career that you want to have. And we're going to insert your picture smiling next to me, living your authentic health career. And I hope today was a good step in your journey. Thanks a lot for listening, and encouraging you to continue by doing the exercises, by buying the book, and for applying for Health Career Connection. So with that, I'm going to stop sharing, and I'm open to your questions and some further discussion. Thank you.
Awesome. That was amazing. Thank you so much. I wanted to give you guys a couple of minutes. Any follow-up questions for Jeff?
It was more of a personal question, but what is your tribe, if you don't mind me asking?
It's the Lumbee tribe, Lumbee, Lumbee. It's in rural North Carolina, and it's the largest tribe east of the Mississippi. And yeah, that's my tribe.
Any other questions about exploration or any of the that Jeff brought up? Is that a stretch or a question?
Actually, good question.
Oh, okay.
Does your health, does the HCC have internships going on throughout like the UCI school year?
So our primary internships are in the summer. However, we also are offering fall internships now, and so that would be during the UCI school year. And then many students, 71% of our students, either get an offer to extend their internship during the school year, or they get a job after they graduate. And so it's an entry point and a stepping stone into at least some more experience and exposure and mentorship that you get. So yeah, that's when we offer our programs, and they're paid opportunities because we want you to be paid for your time and have good value for what you bring, and help cover your costs, as well.
I saw a couple questions back here.
Hi, Jeff. Thank you for your presentation. I just wanted to ask a little bit about proper etiquette or insight in how to approach informational interviews and the best way to do that.
That's an outstanding question. In our book, we do outline that, but I'd say that the magic words are: I'm a student at UC Irvine. I'm a student in the Prime Pre-Health program, and I'm interested in doing an informational interview with you. People really love to talk with students, and you can either do that outreach by meeting somebody and just going up to them, and a speaker in your class, a speaker at a conference, somebody who comes in your student health club. Or you could reach out to alumni. You could find out who are alumni from UCI who are doing work and ask if you could do an informational interview. You can do it through participating in different internship programs. And like HCC, we have informational interviews all throughout the summer. Or you could reach out to people via email or via LinkedIn. In LinkedIn, you could look up who's from UC Irvine that's an alum that's working in the area that you want to work in an organization. You could just reach out to them and say, hey, I'm a student at UC Irvine, and I'd like to start a conversation with you. I'm wondering if I could have an informational interview. And so the etiquette is to ask very politely, to be very open to their schedule and accommodating their schedule. I have students who reached out to me and said, Jeff, I can meet you next Thursday at 8:00 in the morning. Will that work for you? And I'm like, well, why don't we talk about what's my availability, and let's figure out something that works for both of us. And so be flexible, be patient with people. They're very busy. Oftentimes it might be 2 or 3 weeks or a month before they set up a time with you. They might also not get back to you right away, but don't take it personally. It's usually because people are busy, and try again with a gentle reminder. Hey, I know you're busy. I'd still like to have an informational interview with you. Is it something we can do in the coming weeks? And then when you have the interview, do your homework ahead of time on the organization, on the person, so you don't ask them questions that you can get on the internet or on LinkedIn. Come prepared with questions. Come prepared with a little elevator speech about yourself at the beginning. This is why you want to have the informational interview with them. Write them, take notes during it so that they can see that you're listening, and send them a thank you card afterwards, or a thank you note via email or card. And then if you feel like you had a good connection, ask them to link in with you. And so that way, every person that you do an informational interview with can become part of your LinkedIn network. And then you can hopefully follow up with them at different times. So that's kind of a high level of the etiquette. There's lists of questions for informational interviews on the internet. I bet the UCI Career Center has those. My book has those. So yeah, that's the etiquette. It's a great question.
I think we have time for one more. We're already way over time, so let's just do one more question if there was one. I saw one in the back, I think.
Do you have any suggestions on finding, I know you provided us with some internships, but other opportunities to really get that practical experience you were emphasizing?
Yeah, I mean, I think depending on what year you are what year are you in your program in school? What year in school?
Third year. I'm a third year.
Yeah, so I think prime time, between third and fourth year is prime time to do an internship or a research program, or to work get a part-time job in the health field, rather than just like taking a job on campus to make some money, or whatever. Sometimes you gotta do what you gotta do, but if you can make it so that you can get some experience, that's important. I do think that, it could also be experience being in a student health club. When I was in a student health club, we organized a health fair. That was a good experience for me. So you can go with what you can do. The other thing is to get it to work afterwards. I really highly recommend. I know it's not what people often want to do. I know it's often what people's parents don't want you to do, but I do encourage working post undergrad, even if you're going to medical school, to just get that hands-on experience, the exposure, to find mentorship, and make sure. And then it also helps you make the case. Some graduate programs you need to have experience, and the average age of medical students now is 24 point something instead of 22 point something, because people are working. You can be in AmeriCorps, you can be in Peace Corps, there's a lot of different ways. You can also just volunteer too. Volunteering is good experience. So I'm excited about your desire to get more experience, and those are some options. I'd be happy to help all of you. I can work with Lena to support you all to try to find great experiences. I think the opportunity that you're going to get through this program and through all of her connections are going to be valuable too. So thank you all so much for your attention tonight. I know it's at the end of the day, and I know I shared a lot with you, but I'm really hopeful, and I'm actually confident that it'll be helpful to you. So I look forward to seeing you pursuing your authentic health career, and I'm happy to support you.
Thank you so much.
Thank you so much. Good luck. Please take care. And thank you, Lena, for this opportunity.
Yes, thank you. Thank you.
Bye-bye.
Bye-bye.